Hey everybody, welcome to Hormonally Speaking. Today I have a very special guest here who is both a colleague and friend of mine, and she is somebody that I really wanted to have on the podcast because this topic of endometriosis, which is really feeling like it's much more common these days. I don't know if that's true or not, but it's feeling like it, paired up with struggling to conceive. This is a big thing that I think a lot of women are facing that is not being talked about enough. So I'm really excited to have Lizzie Alexander here, who's a PhD and a certified integrative nutrition health coach and holistic massage therapist. Lizzie specializes as a women's health coach for women with endometriosis wanting to get pregnant. She's an entrepreneur and a mother of one. She used to be a marine biologist, a scientific researcher, and environmental consultant, but she is now a certified coach with a love for health, hormones, nutrition, and cooking, in particular, endometriosis and fertility. You can find her at endofertilityspecialist.com, and she also has a Facebook group for women that are struggling to conceive, and that is Thrive and Conceive with Endometriosis, and that will be in the notes, that link, so you can go there and join her group. Welcome, Lizzie.
Thank you. I'm really excited about today's interview and just delving in a bit more and talking about a subject that I love talking about.
Yeah, well, as I mentioned, I feel like we hear about endometriosis so much more now than we used to. And, is that partly because women are just getting diagnosed more? And actually, let's back up a little bit for those that don't really understand endometriosis and just kind of talk about what it is first.
So what it is, basically, it's the thing that comes up first is pain. So that's the thing that really that we see is pain. It's pain when you have your periods, it's pain during ovulation, pain during bowel movements, particularly stabbing pain. So there's different levels of pain as well. So like I said, you've got the stabbing pain, you can have throbbing pain, it can be ongoing pain, but pain is the big thing. Also pain during sex. So these are the big signs that potentially you've got endometriosis. There are lots of other signs. The pain is associated with inflammation. So with endometriosis, you you have inflammation issues. You've got hormonal imbalances, but also you've got signs that your immune system is basically out of whack as well. So different symptoms, you need to look at them, will show you what's going on. So the pain and the bloating is a sign that you've got a lot of inflammation going on. And then things like PMS, breast pain, clotting, these are all signs of hormonal imbalance, which I imagine you've talked about a lot of, during your previous podcasts. And then the other one, which is poor immune functions, basically, is like frequent bladder infections, yeast infections, thrush, catching a cold easily, sensitive to smells like skin sensitivity, food sensitivities. They're all signs that basically your immune system is like on this constant watch out because you've got this inflammation going on. I had a lot of thrush over the years and couldn't work out why I kept getting it all the time. And then as I started delving into what was going on, it came back that was related to the gut, but we'll talk about that later on. So the big signs really are the bloating and the pain. So painful period, painful sex, bowel pain, water retention, that kind of thing. So yeah.
Nice. I had no idea that having thrush, consistently was one of the big signs of it, because that's something that, I think quite a few women deal with at different points in their lives and may not have made that connection. So when you mentioned like feeling it, bladder and then bowels, so that is because the tissue that's only supposed to be in the uterus makes its way essentially outside of the uterus, right?
Yes, exactly. So it's the fact you've got these endometrial growths on the outside of your womb. So it's not on the inside of your womb, it's on the outside of your womb. And this then causes inflammation. So you may not necessarily, so some women will have the growths on their bowel, they'll have them on their bladder. And unfortunately, it can end up basically the lesions, and then the scar tissue that's caused from the lesions will end up causing organs to stick together. So your ovaries and fallopian tubes can then get stuck to the back of your womb, can be stuck to your bowel. And so depending on the degree of growth that you have inside would depend on the degree of endometriosis you'd be classified with if you had a laparoscopy. So basically you can be told that you've got stage 1, which is the least, up to stage 4, which is it could be covered over all sorts of different organs, and you could have these organs stuck together. And if you get lesions on the bowel, surgeons will not particularly want to operate on that. And you know, we've talked about this before in terms of, you know, what damage that can cause to the bowel. I mean, I'm not an expert in terms of the surgeries and what they do in terms of the surgeries. That's not kind of my speciality. I know a bit about it, but that's not what I kind of know the most about.
Right. Well, you're kind of looking more at root cause issues, right? And bringing down the inflammation because, you know, we have sort of probably not a lot of control over it sort of landing in these different areas, and especially if it lands on the bowels and that kind of thing. And as you know, anybody who's listened to this podcast knows, these surgeries can go awry, especially if there is this tissue right on the bowel. And absolutely, we don't want to, you know, get the bowel nicked. So I, you know, kind of approaching things from that bringing down the inflammation standpoint, I imagine is kind of the goal, right? And working with it. And then it impacts the rest of your system too, which I would imagine is super, you know, important in terms of getting pregnant. You know, your immune system can't be like just on like go all the time and your body be ready to get pregnant.
No, so exactly. So the way that endometriosis affects fertility is the biggest thing is the inflammation. They still are a lot of uncertainties as to exactly how endometriosis can cause infertility, and it's not necessary that it does always. So that's what they're still kind of trying to understand. That they reckon that about 40% of women with unexplained infertility is due to endometriosis.
Wow, that's quite a bit.
Which is quite a bit. But there is often other things that come in. So like every woman is different. Every woman's endometriosis is different. And what I'm finding very much with my clients and many other, you know, women who work with women with endometriosis will say the same, that the root causes behind it, which is still so unknown. I mean, as endometriosis itself is still very unknown, but what we're finding is that what is affecting one woman is not the same as affecting someone else. And it's the same for their fertility. So you kind of match the fact they've got endometriosis and they're struggling to get pregnant, and it's not going to be the same for every woman. There will be generic things like in terms of inflammation. So it's an inflammatory disease. So inflammation is the thing that you need to bring down, because what happens with when you're trying to get pregnant, the really obvious things, you know, you get the sperm, which basically enters inside you, makes its way up the uterus, up into your fallopian tubes. And obviously you have an egg released out of your ovary, which then moves down your fallopian tubes. When you've got inflammation, that can cause inflammation within and around basically your fallopian tubes, your ovaries. So a good example would be the inflammation can actually impede the release of an egg. So basically the little sort of villi that are along the inside of the fallopian tubes, they'll be so inflamed they actually can't even move the egg along. And so therefore it's causing problems, and you can't even, you know, the sperm and the egg can't even meet. But then if the egg actually does end up being fertilized, and you want, you know, the egg then moves down into the uterus for implantation, basically the inflammation within the uterus, what they're finding is you basically get these cytokines, which are caused as a result of the inflammation, and they secrete toxins, and those toxins can cause the embryo, either it's fine and it ends up embedding in, but then you end up miscarrying because, you know, those toxins cause basically a very poor environment for the egg to continue to basically grow.
Right.
So this is where inflammation is really one of the key things you need to reduce.
It's so interesting listening to you talk about that, because I hear microvilli and I think, the gut, right? Because we have the microvilli all through, especially the small intestine. And when inflammation is going on, it's kind of a similar issue, right? Either the microvilli, like by certain foods, if you're celiac, it's kind of like those microvilli are like mowed over. It's like somebody took a lawnmower and just, like cut them out. But also this, this issue of not being able to break down food properly when there's inflammation going on in the gut. And then that, leads to more inflammation, because when the food makes its way through your intestines and it's not broken down properly, it's very irritating to the gut, And so it's kind of the same idea in some ways of, the embryo struggles to get implanted when there's inflammation, and it's like food struggles to break down, and the nutrients that you need from that food to absorb that, it doesn't happen, or it doesn't happen as well as we would like because of that inflammation. So you can really see how inflammation underlies so much of this stuff. Yeah,
massive amounts. And then of course it not only it affects that way, but in terms of your womb lining, the inflammation is going to prevent, like you said, the nutrients getting through, as well. You get basically stagnation, you get pooling. I mean, in Chinese medicine, they view endometriosis as kind of like as a stagnation disease. So it's like your pelvis is just stagnant. And it was quite interesting. I was doing some research earlier, with regards to massage, because massage is a fantastic way basically of improving blood flow and oxygenation and bringing in nutrients. And as a massage therapist, this is something I also, I love, is massage. But one of the things that you can also get is you can get pelvic congestion syndrome, which is basically the veins around within your pelvis, around the outside of your womb, enlarging. And what I found, which is quite interesting, is that excess estrogen causes your veins to enlarge. And so then the pool, where the blood pools within those enlarging veins, causing stagnation. And a lot of women who have pain, and also this causes pain. So I imagine a lot of women who have pain might be not diagnosed with endometriosis. They might be told that they have pelvic congestion syndrome, or vice versa. So there's a bit of a kind of quite interesting link between that, and then also the connection with fertility.
Well, I definitely want to hop into talking about ways to work with inflammation, but I want to step back really quick, because I realize, we didn't talk about, and people might not know, how you actually do get diagnosed with endometriosis, especially what you're saying, that, some women will get diagnosed with the wrong thing. So what is the process of that?
So the thing with being diagnosed, it is difficult. I won't lie. There are many women who, I think the proportion, it can take, they say on average between 8 to 10 years to get diagnosed, which is crazy. And for many others, it's longer. I mean, for myself, I didn't get diagnosed until I was 30, I always forget, 37 or 38. Wow. And I had painful periods at the age of, my period started at 11, and by 14, I was on the pill. 13 or 14. Yeah, I was on the pill because of pain, because I was passing out, unconscious, throwing up. And all that time, and I had so many symptoms, through the years, on and off the pill, blah, 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 blah. I won't go on about it. But looking back, there are so many aha moments. There are so many times where it's like, aha, that makes sense. I had chronic fatigue for years. I even had a laparoscopy when I was in my late 20s, because my coil got stuck up my fallopian tube and was causing me pain. And they went, this gynecologist went in to go and find the coil basically and remove it out. And at the same time, she thought she would do a laparoscopy and just check around my womb. And afterwards she reported to me, and this was on my notes, it was confirmed, a couple of years ago, that she thought that I had either an old STD, because I had scarring on the back of my womb, or I had pelvic inflammatory disease. It was
not endometriosis,
but she didn't know because she wasn't a specialist. So that's the thing. Not all gynecologists are experts in. Because you need, just because you're one thing doesn't mean that you know. Do you know what I mean? You don't know about everything.
Right, and it's a very specialized thing to know about.
So basically, on my notes, because it said that when I was going with my fertility issues, they basically ruled out endometriosis. Nobody ever questioned me because someone had put this on my notes.
Right.
And so the thing really, I would say, in terms of getting diagnosed, is to make sure that you actually, if you have got painful periods, you know, heavy periods, anything is wrong with your period, to be honest, because your period shouldn't be painful. You know, it shouldn't be. And if it is excruciatingly painful and you can't go to work, you know, for 2-3 days a month, it's affecting your life like that. Start recording, start making notes of what your symptoms are. Make sure you record what's going on with your period in an app or a diary, so that when you actually go to see the doctor, you've actually got evidence of what's going on, rather than just going in and going, I've got painful periods, and they're like, yeah, whatever, that's normal.
Yeah, here's birth control
Not
pill.
normal.
Yeah.
But the point is, they'll start to listen to you if you've got a better sort of a log, you know, and if you log down, because the thing is, you forget yourself so many of the symptoms.
Sure.
Bring to, you know, I never connected the fact that painful sex had anything to do with it. I was just like, sex was meant to.
That's just who. That was your body. Yeah. Oh.
Yeah. I mean, was it normal to then lie there sort of screaming for hours after you've had sex? No, but I just didn't tell anybody because it's embarrassing.
Right. Ugh. And that's what we do as women, right? Is that we hide those things that we're like, well, it's us, or, well, this is just the way it is. And so we don't want to talk about it and think that there's something, you know, even go to a place of like, oh, there's this something else that's creating this situation for me.
Exactly. So for me, that would be the big thing is those things, even those things that are, you know, you're embarrassed about. Painful bowel movements. Again, that's another embarrassing one. You know, many women sitting on the toilet and just having stabbing pains that you just want to die from. I mean, it's just awful. And I remember when I went, eventually I took myself off privately because my mother had heard a radio program about endometriosis. And I think this is where, just coming back, where you say, have more women got endometriosis? I don't think so. I think the awareness has increased, which is fantastic, because particularly in the last 2 or 3 years, I think just the awareness has really ramped up. I think with the internet, people are searching and having questions about it. People used to put up with things. So I think just that voice is getting out there, and, you know, things are changing. So for example, in the UK last month, in conjunction with the Endometriosis UK, a very brave woman basically had recorded a video which was then about her endometriosis and how it affected her career, the fact she was having to take off time from work, and that was actually showed in the House of Commons.
Oh wow.
So I mean, that's huge.
Yeah.
So to really raise that recognition, to basically so that places of work could understand why women might be taking off a couple of days off a month and not to be penalized for it. So it's becoming something that is becoming more aware, which is really good, and hopefully that will help with diagnoses and that they don't take as long as they can do.
Yeah. So when did you finally get diagnosed?
So my diagnosis, I never went really, I mean, I did go many times to go and say, oh, I've got pain, and they would just sort of push me away or do investigations and nothing came back. So I eventually got diagnosed at 38. So yeah.
And what was it? So this new, because you reached out to kind of a new doctor so I went to I'd been going for fertility. So it all became, and this is what happens with so many women, is that basically they'll find out when they want to get pregnant, and they're like, I can't get pregnant. So that's what happened with us. We'd been trying, we couldn't get pregnant. And when you're older, you basically don't have to try as long before you can go to the doctors, but we'd still been trying, I think 18 months and weren't having any luck. And I was 38. I think you can go after 6 months. Gotcha.
So we went, and here in the UK, you go through the NHS. So it's longer than, say, if you go through private, but we have the advantage of not having to pay for it initially. But you then go on a waiting list. So of course, went to the doctors, got put on a fertility waiting list to go to the fertility clinic to go and do further investigations, which they did. You know, the usual scans, were the fallopian tubes blocked, that kind of thing. Were there any cysts? Were there any fibroids? You know, and there was nothing like that. And they basically said, oh, we can't find anything. And I said, oh, I don't believe it, because I'd always had a gut feeling since my early 20s that I was going to have a fertility issue. I had no
Mm.
idea. It was just a gut feeling.
Mm-hmm.
And so I didn't believe the doctor. I just said, you know, I'll take myself off privately, because I was lucky enough to have private insurance. I did. I went and checked my hormones. The hormones came back with nothing, interestingly, which is another conversation, because I think there was a lot of blood tests there, and they don't look at optimum. They look at sort of, And then that's when my mother heard the radio program. So then I went back to my doctor and basically said, look, I think actually after doing, you know, a bit of reading, I think I've got endometriosis. And she said, no, I don't think you have. I was like, I don't care what you think. You need to refer me to a specialist, and then let's see what he thinks.
Right. It's like nothing else was showing up. I mean, come on.
And it's like, don't be a block here.
Right.
And I was panicking at this point. It was in the February, and we'd already been told in the December that we were moving to Jordan.
That's right.
In the May. So it was February, and then in May, I was 38 years old, going to be moving overseas for 2 years. I'd be 40 by the time I came back. And I was like,
this needs to happen now, people.
The alarm bells are like. So basically, I took myself off and I said, all you need to do is write a letter so that I can go privately. I'm not even asking to go through the NHS. I don't have time for that. Just write me a letter. And it took a lot, even for her to write the letter. I got the letter. And then, went off and saw this doctor, and he was the first one who actually listened. He spent an hour asking me questions. Asking me questions like I ask my clients now, you know, delving questions from literally from when you're born, you know, everything, to know your entire health history. And he just nodded, but kept looking over at this nurse that was sat there, you know, when they have that knowing look.
You're like, what are you communicating right now?
And at the end, he said, to be honest, I reckon 99% you've got it. I'd eat my hat, is exactly what he said. And the relief, I have to say, that someone thought they knew what was wrong with me was huge.
Oh, I can imagine.
Was massive. I mean, I remember sitting outside in the car and just crying my eyes out in relief, and wishing my husband had been there, and I'd not brought him, because I thought, I don't want another wasted appointment. I don't, you know. So it was big, but then I went in for a laparoscopy 10 days later, and
because that's what you have to do, right, to actually get really diagnosed.
They can't. I mean, some really specialist, really good doctors that really know their stuff may be able to tell on people that have got, you know, stage 3 or 4 endometriosis. They may be able to see things, but if you've only got stage 1 or 2, you may not see those things.
It's incredible to me that we don't have, between ultrasounds and MRIs and everything, that there's not, you know, a way that they can tell at this point, but it doesn't get that clear, you know, because I remember, you know, I mean, this is very different, but on a CT scan that I had in order to get my reversal surgery, you know, it showed that I had an ovarian cyst on there. And obviously that's a growth that's going to show, you know, a bigger growth that's going to show in a different way. But to me, it's like, this stuff is supposed to be so, you know, pinpoint exact, especially with an MRI or a CT scan too, where you have to drink the contrast dye and all that. You're like, how can they not be, you know, up on that? And to me, part of that is it just hasn't been a priority to determine this stuff for women. You know, women's health hasn't been a priority. It's becoming more of a priority now.
Yeah, and I agree. And I think research, and I know in the UK with Endometriosis UK, that's where they're trying to push. They're trying to really push with, you know, raising funds to look into the research to try and develop that, so it is easier to diagnose than just to have a laparoscopy, because that's, like you said, it's the only way to actually see. And of course, when you want a laparoscopy, you need to have it done by somebody that knows what they're doing.
And is it all, can they go vaginally, or do they have to cut you?
No, they have to go in, because they're looking on the outside of your womb, basically, not just on the inside of your womb. So they do have to then go in with what they called keyhole surgery.
Yeah, gotcha.
Yeah, so they do have to have a look. And the thing is, like I said earlier, you can have people that aren't specialists and then they miss things. So you really do need to check up on who your surgeon is, and actually, in hindsight, because I did everything very quickly because I was in a massive hurry, I didn't have the best surgeon at all. So he was very good in terms of, he diagnosed it, he was very sympathetic about it at the time. However, afterwards it was I learned then I had ablation. I didn't have excision. So there's a difference between ablation and excision. Ablation is, so imagine you've got an iceberg. Ablation is basically cutting off the top of the iceberg, i.e. what you can see above the water.
Gotcha. Okay.
Excision is basically taking the whole iceberg out. The bottom, what's underneath the water, i.e. the root. It'd be like taking a tree out. So it's taking the roots rather than just cutting it off at the stump. So then it supposedly prevents it from regrowing. Excision does, rather than ablation.
Right.
With ablation, you've left the roots in there, it can continue. People do say that excision stops you from regrowing again. But to be honest, I would slightly argue it depends on what the root cause of why it's grown in the first place.
Right.
If you don't get rid of the root cause, it probably is going to come back.
Yeah. And it may be slower growing. It may take a while to come back, but ultimately, yeah. And I feel like I've heard that a bit too, that it's more successful, obviously, the excision surgeries for people. And I do know, I have a couple clients and some friends that have had the ablation surgery, and they were frustrated later when they learned that the excision surgery would have done much more for them, because really the ablation didn't do much for very long.
No, mine, I had pain back within 6 weeks.
Oh, wow. Talk about not very long. And to put your body through surgery for that. Just as a reminder to people, we think surgery is so, so common that we think it's not that big of a deal, but it is a really traumatic, hard thing on the body. Even the keyhole laparoscopic surgeries, it's intense on the body. And so to go through that, to only have pain, 6 weeks later again, I would have been very frustrated for sure.
I was devastated, because the thing is, what they say, if you're particularly having a fertility, they say within 6 months of having the surgery, you have a much higher chance basically of conceiving. So to then have got the pain back within 6 weeks, because at the time I hadn't stopped any of the things that were my root causes. So of course, first of all, when you have ablation, you then cause scar tissue. So the scar tissue can cause more havoc than the endo itself. Then of course you've got the endo growing back. And if you don't make any changes, because I didn't particularly know about it then of course it probably is going to come back. And I had a lot of stress. I had surgery, had 2 weeks to recover. I gave up my job. I restarted, started a new business. I moved countries. The stress around it, I'm not surprised. I was taking my massage therapy exams. I'm not surprised that then caused further inflammation. I wasn't eating very well. I wasn't sleeping well. So all of these things on how you can actually then work to improve your endometriosis symptoms, for me, were really, really bad. So I'm not surprised now why it came back. And of course, because I had the ablation.
Well, so at what point did you start to understand and come across what your root causes were and to work with those?
So I, as I was finding out, or just before I was finding out that I had endometriosis, I'd started like a fertility coaching course. And so that was my first sort of insight, that you could help your body heal. That was the first, that really was where I realized that what I thought was a healthy diet really wasn't. And it was kind of going through an understanding about my menstruation, understanding about healthy periods, kind of thing like that. And then, so I was doing that, and I continued to do it remotely when I got to Jordan. But then when I was in Jordan, I got the pain back again, and I was desperately frustrated. I then looked into, could I find an endometriosis coach? Because I found this fertility coaching, which I'd found very much by chance. I didn't know about coaching. In the UK, coaching isn't really certainly wasn't even a couple of years ago. It's becoming more common, but it's not like in the US, where it's, you have life
everywhere.
Yeah, in the UK, talking about our feelings.
Yeah,
it's not,
that's
a bit prim and proper,
right?
So it kind of opened my eyes that you could, find these other people. And so I found an amazing woman in New Zealand, Melissa Turner, so she had like a coaching course basically, and I followed that, and that's when I delved so much deeper. And I know before I started it, I was kind of like, what am I going to learn more? I've learned loads of stuff on this fertility coaching and learned to use coconut oil and blah blah blah, and I thought, what more can I do? I mean,
You're
boy,
like, coconut oil makes everything better, come on.
And that's when I kind of learned a lot more, and I learned to understand what endometriosis was about, the inflammation, about my immune system, like having the aha moments. I mean, I'd had 3 years in a row where I'd got depression. I'd had the signs of skin sensitivity, food sensitivities. I think the worst skin sensitivity was when I ended up in hospital with anaphylactic shock, having been stung.
Wow.
And it went all around my face, all around my throat. I was in Canada, didn't have any money, didn't have my wallet, left it all somewhere because I'd been stung. Oh, no. And that was my body going, will you not listen?
Come on, what do I have to do?
I've been telling you.
So
that's a classic, is like stings is a classic. So that's your immune response is just
in overdrive.
And so when I then learned about all of these things, it was kind of like, aha, now I understand. And then kind of went through finding out what I then needed to do to reduce the inflammation, to sort of regulate my hormones, and then kind of, and as that went, my immune system sort of regulated itself. And I didn't have the food sensitivities as much. I've still got some.
Sure.
Because I'm not 100%.
So can you give us a couple of examples of how to go about bringing down inflammation, knowing that it's, slightly individual, but what are some good places people could start?
Well, the best place to start is with food. So it is with nutrition, because actually it's the easiest place to start. A lot of women will be like, no, that's not easy, but it is when you kind of know what's going on. It is the easiest place to start. And the biggest one really is gluten. So you've got some inflammatory things, and gluten is a big one with women with endometriosis, and it's always worth giving it up, at least trying for a month, seeing if bring it back in again and see if then it actually cuts out your period pain. I mean, for me, I reduced my period pain by about 70% within a month.
I just to interject here really quick, because I have some clients that will be in denial around that. Gluten, dairy, and coffee are the hardest things for people to give up. But even sometimes they'll say, oh well, I cut it out for 30 days and it didn't really make a difference. And I say to them, cut it out for 3 months and then talk to me too, because sometimes it can happen right off the bat, but sometimes there can actually be so much damage from gluten to the intestines that it really takes not only a few cycles, but also just, in terms of your gut health to feel different. It takes 3 months or more. So just a little interjection there.
No, and I think it's absolutely brilliant, because it's what I actually say to my clients as well, in terms of, it's also very easy to give up the gluten and then not necessarily heal the gut. So you can give up the gluten, i.e. remove the inflammatory causing foods like the gluten, the sugar, the soy, the coffee. But if you don't then help your gut heal, it's not going to help you, because you'll still get the large food particles then going into your body, causing inflammation. So you've kind of got to do the both. You've got to remove the inflammatory causing foods, but also do the healing.
Yeah. So what are some of the things that you did to help heal your gut?
So bone broth is a really good one. Make your own bone broth from organic bones. It's full of the collagen, which is really, really good for healing those holes that basically get caused by the gluten. Basically you get these holes, so you end up like a sieve. They call it leaky gut. So that helps to heal those holes up, so then larger food particles don't then end up going into your bloodstream, which is what you don't want. Things basic like learning to chew better.
That's a big one.
For me, it's stomach acid. In fact, stomach acid test, I think when I did it to see how much stomach acid I had, it took me 45 minutes till my first burp instead of
wow.
So I literally had nothing
going on.
So I mean, learning to heal my digestive system. So that for me was a biggie. And I used to do self-massage of my abdomen. And when I massaged my stomach, the pain my stomach to touch my stomach.
Oh, it was just so inflamed, huh?
It was so inflamed. And it's interesting, if I end up having gluten now, and it does make me think I should test for celiac. When I have gluten now, my stomach just gets painful again just to touch. So like if I'm holding my little boy and he kicks me, it's painful. So yeah.
Yeah. Well, it's interesting with gluten because, you know, some of the, I've had this happen with clients where they do a celiac test and it comes out, you know, that they don't have it. But some of the more, you know, recent research is pointing towards non-celiac gluten intolerance being, and I don't want to say just as bad, but it has a lot of the same symptoms, you know? So I always tell people, don't let it stop you from, you know, consuming or don't keep consuming it because you have found out you don't have celiac. And, you know, I definitely, with the testing that I use, the GI map and the MRT food sensitivities test, you know, most people do end up showing some of the antibodies to gliadin, which is a component of gluten. And so I tell people, you know, this isn't that you have, you know, it's definitely not that you have celiac. It's not even saying like you absolutely have a gluten intolerance, but it's a really good indication that you do. So, you know, for this period of time, for this healing protocol, let's take it out, you know, and then often people, if they try it again later, like they notice right off of that, like you're talking about, you know, that does not feel good.
And I know for me, I struggled for years with the idea, not to do with the endometriosis, but I had chronic fatigue in my 20s, which I now know is related to the endometriosis. But I mean, for a year I was bedridden, and I had people saying, why not try giving up gluten and dairy? That will help with the fatigue. And I was like, nah. Yeah, I just wasn't open to it. I tried everything else, but I wasn't open to it. So I can understand it's a big thing. It's I mean, now is less so than 10, 15 years ago.
Right, because there's more options.
And I'm not talking about the gluten-free nasties. Right. I'm not talking about those, which are worse than the gluten itself.
Yeah, a lot of them are, that's for sure. Yep.
But there's other options. Like I don't think buckwheat, for example, was really common as a, you know, as an alternative, you know, the alternative grains that you could get into your diet, I don't think were as common, and therefore you're kind of left with not so much. And the other thing, because you asked what people should, in terms of what they should do to reduce the inflammation, is go on to an anti-inflammatory diet. But where I just want to link in with what I was talking there is, if you might come up that all sorts of foods might cause inflammation for you, and then you end up having to cut out loads. But the reason why that is if you haven't healed your gut, of course, those foods are going to still continue to go into you, cause an inflammation reaction, and therefore you're going to cut this stuff out. Now, if you're just looking at endometriosis, that's okay. But if you're looking at fertility in conjunction, this is then going to start causing issues because you're going to end up undernourishing yourself. And it's one of the things that with fertility is that if you are undernourished, that's not going to help you get pregnant. So you need to check, you know, key nutrients and making sure that you are getting a really nourishing, super, you know, sort of nutritional diet. So when I talk about sort of fertility, I like to make sure that you get all that nutrition in there as much as possible. So it's about healing the gut so that you can then start to make sure that you can get that nutrition in there. I mean, with gluten, I mean, there's so many tangents I could go down here. Like, so many links, but with gluten, I mean, a lot of people who have suboptimal fertility are often iron deficient. And if you then try and raise their iron and then they struggle, their iron is not coming up, and it's not just their blood iron, it's actually their ferritin, so what you call serum ferritin, which is their iron stores. And if your iron stores are low, your body will not want to basically get pregnant because you need so much iron to grow a baby. But if you have gluten sensitivity, it basically stops you absorbing iron specifically. So if you then give up the gluten, you can then, and heal the gut, you can then increase your iron. So there's a link between different things. And if you're finding your iron isn't raised and you're still eating gluten, then the first step is to give up the gluten and then see if that works.
And to sort of jump off that, I think that that's actually true for several key nutrients. You know, I see so much. Vitamin D is low in so many people. Vitamin B12, which is, often connected to the iron situation. But these are things that, I look at my clients, that's usually easy blood tests for them to get through through their regular doctor. And these low levels are happening all the time. And it's not just that there's an epidemic of like, everybody has low, levels of these nutrients. There's these underlying causes, and it's really the gut needing to be healed, so that it can absorb these nutrients. And I just want to point out to everybody listening, whether you're listening because you do have endometriosis and you're trying to get pregnant, or you're just listening because you're listening, everything that Lizzie's saying is true for any hormonal issue, and really like any gut issue too. Like it's amazing to me because I'll talk to, people about all these different aspects of hormone issues. And it really always comes back to the gut, that's where you absolutely have to start. And you absolutely have to regulate your digestion. You have to heal that leaky gut. You got to bring down that inflammation, which is going to happen by doing those other things. And just get that nutrient dense food in your system. And that's when the hormones, I don't want to say will take care of themselves, because there's more work you have to do sometimes. But it's going to allow for the hormones to really start to heal.
Yeah. I completely agree with all of that. I think that there's just so many parallels between different things, and so many women might come with different issues. They might have low cortisol, they're really fatigued, and you kind of have to then work on that, and then that's related to sort of insulin resistance, and then you've got thyroid issues. So that's again related to your gut, and
it's never ending. Let's talk a little bit about estrogen and how that shows up with women with endometriosis.
So what happens is with endometriosis, most women, and I say most, not all, have estrogen dominance. It has been found that there are receptors that are progesterone receptors rather than estrogen receptors, but the majority of women have estrogen dominance, i.e. they have too much estrogen to their progesterone. So they can either have high estrogen or low estrogen, but they've got too much compared to the amount of progesterone they need to have. And that doesn't help with inflammation as well. And also what happens is their liver. So basically their liver function is poor, and quite often their detoxification pathways are basically stuck. They're not detoxifying the estrogen, so estrogen gets detoxified within the liver. And there are different processes. You can go into all the detail. I don't know whether you want us to go into that detail right now, but what happens is you can end up with the estrogen metabolites basically being recirculated around your body if you don't detoxify them, and they get excreted out, and that's when they can cause a lot of further damage. And it's said then that those estrogen metabolites end up triggering further growth, endometriosis growth around the outside of your womb, etc. So estrogen is the one that's an issue, and that's where you need to really work on your liver and your detoxification pathways as well, particularly phase 2 detoxification. And the other thing is, I'm not going to get into it. It's another rabbit hole to go down. About methylation, but I'm not going to talk about it. It's too many rabbit holes.
Well, to link back to what you were commenting, about your story and doing hormone testing and everything turned out quote unquote fine. I'm assuming it was serum tests that they did, and half the time they don't even do serum tests on the right day, much less the serum test even giving you that much information, even if they do it on the right day, right? So what do you think is sort of a better approach if women do want to check into their hormones if they're having issues?
So the really basic one, so if you don't want to spend any money, a really basic way is basically through basal body temperature, so measuring your cycle. And that will give you an indication. So if you've got a lot of fluctuations within your temperature range, both in your first half of the cycle and second half of the cycle, both your luteal and follicular, they will fluctuate. And that shows that you've got your estrogen is not stable and your progesterone isn't stable. You want those as flat as possible, and you want your estrogen your progesterone higher than your estrogen, because that's what happens in your body. Progesterone basically is I can't think of the word now. It basically causes heat in your body.
Mm-hmm.
It heats up your body. So that's why your temperature increases after you ovulate.
Mm-hmm.
So just this very simple process of taking your temperature on a daily basis and then learning to be able to read and understand, it gives you sort of an empowerment to understand what's going on with your cycle.
Mm-hmm.
But if you really want to drill down and get more detail and more understanding, then I use the Dutch test. Is a really, really good way. So you can do the Dutch cycle mapping, which is it basically you look at your entire cycle.
Mm-hmm.
So Dutch is dried urine test for comprehensive hormones. I know you've talked about it many times, so your listeners will know quite a lot about it now.
Mm-hmm.
And it's just a really good way of understanding what's going on in terms of your estrogen detoxification pathways, whether they're going down the right pathways, whether you are whether you've got an issue with your phase 1, phase 2, and then whether you need to do something about it. So that's kind of like a very simplified way to kind of explain it, but I find that's a really good test.
So I will note, and I'm not positive about this, but I'm pretty sure that unfortunately the cycle mapping in the US does not include the estrogen metabolites.
In the UK?
Know. I know in the UK, I remember you sharing that thing that you could kind of choose a little bit more.
Yes.
So I wish that they would change that. But the last time I checked, that was still the case. It's just your estrogen, progesterone, and I believe testosterone is on there too, maybe DHEA, but it's really just looking at your estrogen and progesterone over the month, which is
weird.
It's frustrating because that is such a big part, and it's why I tend to use the 1 day test with Dutch, because you get that. I do in some cases use a saliva cycle mapping from another company, Diagnostics, that unfortunately doesn't have the estrogen metabolites on there, but it does have FSH and LH, which is interesting. Yeah, okay. It's the only one that via saliva that I know of, that you can get that information too, and you can really see, they map it out really well for the month. But yeah, I think you guys have a little bit more of a choice in the UK around that, which is interesting, right? I know. I mean, I just looked recently again to make sure that was still the case on their, they have on the Dutch site, they have, you can look at the examples of the different ones, and I think that's still the case. So,
do you know why that is? Because obviously Dr. Carrie Jones is from America.
Right. And it's based here.
It's based in the US.
I don't know. I don't know if it's a different company, like if there's a company that works with Dutch in the UK, you know what I'm saying? Like
Regenerous Labs, who I work through. Yeah, I mean,
so they may be able to pair them together differently. I don't know. It's it's an interesting thing. So I will double check on that after saying that, but I'm pretty sure, because that's why I haven't done cycle mapping a few of the times, that it would have been a good thing, because I really wanted to see that estrogen detox. But I do want to go back really quick, and then we could go on forever, but I wanted to say, because I didn't realize with tracking your temperature that fluctuations in either the follicular or luteal, I know I'm always looking for that jump up in the luteal to show that you've ovulated, but that if it kind of goes up and down in the first part, that's your estrogen sort of all over the map. And then if it goes up and down in the luteal phase, does that mean your progesterone's kind of all over the place? Or is that's
the same?
It's the same. So you really want to kind of shoot for a nice and flat through follicular, and then a hop up and nice and flat through luteal. Interesting.
Seesawing, that's showing you've got hormonal imbalances.
Yeah.
Same as another indication is clots. So if you've got clots in your period, that's an indication that you've got estrogen dominance.
That's definitely a big one. Yeah.
So lots of signs.
So I know that I could ask you so many more questions about this process, but instead I will let people contact you so that they can work with you around this stuff, because I think the fact that you have gone through this process yourself, and very deeply, obviously, years and years of even finding out, to figure out that you had endometriosis, and then eventually you got pregnant. For anybody that was wondering, I did mention in the beginning that she does have a child, but you did eventually get pregnant, and so now you help guide women on this process. And as we all know, I talk about on this podcast all the time, it's never just diet. you know, it is absolutely, as Lizzie mentioned at one point, like stress has a huge impact. It affects our adrenals, which affects our sex hormones. And, you know, supplements, there are certain supplements that you need depending on the situation. So, yeah, get in touch with Lizzie. And yeah, and like, I know that you just launched a brand new website, so that's very exciting, right? For people to be able to check that out.
I just rebranded, so
Yeah.
you have to take a look, which is very exciting. And it's the key reason why is actually I'm launching a podcast in 2 weeks time.
Woo!
Exciting.
Exciting.
Very exciting.
Yes.
So that's the Endo Fertility podcast.
Okay.
2 weeks on Wednesday, so less than 2 weeks.
Okay.
So yeah,
So
very
probably
exciting.
when this comes out, it will be about a week away. So
Oh
yeah, I know. So it's perfect. Everybody can hop on. iTunes, I'm assuming you'll be on iTunes, Spotify,
all the places.
Yeah. Okay. Cool. We'll hop on, you know, go ahead and subscribe to her podcast as soon as it comes out so that you can hear all the great episodes. And I will be on one of them.
About to be running a competition actually, so if you check out my Instagram and also my website in the next couple of days, I'm about to launch a little competition sort of with the promotion of the podcast. So I'm going to be giving away an hour's coaching to anybody who signs up basically to my newsletter, so you can hear it, you know, find out when the launch is, and I will be giving away to one lucky winner an hour's coaching. So
that's amazing. That's an awesome gift. Oh my goodness. You guys hop on top of that and somebody win that thing and get on your good new path. So, well, thank you, Lizzie, so much for being here with me today and all this good information that you shared. I definitely feel like I learned some more about endometriosis and, you know, because I am seeing it so much more with my clients, I really, you know, I think it's important for this information to be out there and for people to really understand, and especially if they've been struggling with their periods for many, many years like you did.
Thank you. Well, thank you for having me on. I always feel like with these things, there is so much stuff that, like you said, that you could carry on talking about, you know, fertility. There were, you know, lots of things we could have discussed, but it's a big, small topic.
Yeah, it is. It is.
A big, small topic.
And that's why everybody, you got to listen to Lizzie's podcast, because she's going to be able to dive into each of these little areas, you know, much more in depth. Is it going to be a weekly podcast?
It is. It was going to be fortnightly. I've now turned it weekly. So I'm going to be doing one every other week and having interviews every other week with some amazing people, including yourself.
Yay! Very exciting.
So, so thank you so much for having me on. It's been a real pleasure, and I've had a lot of fun chatting.
Great. Thanks for being here. All right, you guys, I will see you next time.